So again, it does require a signed informed consent from the patient. Patient preparation, a local anesthetic injection will feel like a stinging or burning sensation. And you can let the patient know to expect to feel a heavy sensation of pressure and pushing when the needle is being inserted. Sometimes a crunching sound can be heard or scraping sensation felt as the needle punctures the bone. A brief sensation of painful pulling may be experienced. If a biopsy is performed, the patient may feel more discomfort as the needle is rotated into the bone. Assist the patient onto the examining table and expose the site, usually the iliac crest. Sternum may be used. If the iliac crest is the site, place the patient in the prone or side laying position. The procedure usually lasts between 5 and 15 minutes. Local anesthetic is injected in the skin around the site. The patient may also receive a mild tranquilizer or sedative such as Versed or lorazepam. Aspiration or biopsy procedures are invasive and sterile technique must be observed. For follow-up care, the nursing priority after a bone marrow aspiration or biopsy is prevention of excessive bleeding. Cover the site with a dressing after bleeding is controlled and closely monitor for 24 hours for signs of bleeding and infection. Mild analgesic, aspirin-free may be given. Ice packs may be put over the site to limit bruising. If the patient goes home the same day of the procedure, instruct him or her to inspect the site every 2 hours for the first 24 hours to assess for active bleeding or bruising. Advise the patient to avoid any activity that may result in trauma to the site for 48 hours. There's a link here in your slides that you'll need to access on your own, and it shows a biopsy procedure. A little diagram showing what they're doing. All right, we'll do our questions here. Go ahead and read the questions as we go through and then pause to process your thoughts and get your answers, and then come back and we'll see if you have the correct answer. The correct answer for question 1 is A. All are possible questions to ask a patient regarding symptoms of fatigue, shortness of breath, and headaches. However, older patients are more likely to experience signs and symptoms of anemia, fatigue, shortness of breath, headaches related to diet, and chronically bleeding GI lesions such as peptic ulcer disease. Pause this and find your answer. For question 2, did you answer D as in dog? The nurse should initially review the patient's laboratory analysis for collective signs of pancytopenia related to the patient's report and assessment findings of fatigue, bleeding gums, and chills. Lab data are needed before informing the healthcare provider and deciding whether to administer antibiotic. Obtaining blood cultures prior to antibiotic administration is an important intervention. Antipyretic medications may be prescribed to treat the patient's symptom of chills. Fatigue, just to go back, fatigue is a symptom of anemia. Bleeding gums, a symptom of thrombocytopenia, and chills, a symptom of neutropenia. Go ahead and pause and read through this question. Question 3, the correct answer is C. INR is a more accurate measure of anticoagulation therapy because of variation in PT values across different laboratories. The goal of warfarin is usually to maintain the patient's INR between 2 and 3, regardless of the actual PT in seconds.